Hello, wonderful people. This is my peculiar journey. Welcome back. It has been a while and we've missed you, and we are happy to have you on board again. So I'm your host today, Mary Akinyi, the director of Aruka Safe Haven. Today we are having our wonderful guest. I've known her for quite some time. She is my friend and I am so happy. They say that roses that are crushed bring out the best and sweet aromas. I believe that she will emit sweet vibes and sweet aroma. Lilian, karibu sana. Welcome to my peculiar journey. We are so happy to have you here. So I'll just give you an opportunity to tell us about yourself, who you are, anything. Who is Lilian? Karibu sana, Lilian.
Asante sana. Okay, kwa majina, I'm Lilian Awich, and I've known Mary for quite some time. She happens to be a colleague, to be my colleague, I mean. Okay, we just sat down and saw something which is very important, that now that I've been staying with the child who is having some chronic illness, which is sicklecellanemia, at least to be able to be in a position to educate mothers or parents who are also having kids like that, so that we can touch on 1, 2, 3 concerning the management, the journey, the whole experience. And I'm very much privileged to be here today.
Wow.
Thank you.
Thank you so much, Lilian. Lilian has just told us she's a mom. This episode is going to be informative, educative, and entertaining at the same time. So sit back and listen to us. Karibuni sana. You can begin anywhere.
Thank you, Mary, for this forum. I'm also happy. It's like I just had the same feeling that we need to be heard out here, because I believe many people are suffering. I really didn't want any sane parent, let me just say any parent, maybe to go through what I went through at that time. And it's been a journey, it's been bumpy. But by God's grace, the boy is now 13 years old.
Wow.
And I feel it's something good if I can share my journey with the boy for the past 13 years up to now.
Yeah, we can't wait to hear this story. Please share with us, because I came to realize, I personally, I didn't even understand what sickle cell is until the time we talked. Like nilikuwa nashtuka najiuliza hii sickle cell ni nini. People hear of sickle cell and they think of death. It's a death sentence. It has a lot of stigma around it. And so today I'm so happy that you're here. At least you'll tell us about it. We'll be able to understand and just create awareness about what this sickle cell is. So now we get to, now you've discovered that this boy has sickle cell. How was life back then? Before now he was maybe born. Did you know about this thing? Yeah, just take us back. How was life? How was it?
Okay, I first heard of sicklecellanemia way back while, by then I was in Form 2. And we just did it, I think, as a unit.
Oh.
Yeah, I just about it.
There was a unit about sickle cell?
Yeah, about the genes and the gene mutation. You remember in biology?
Oh, okay.
For biology students, I think they understand it better.
Yeah.
This is something that's associated with a lot of stigma.
Yeah,
so
true.
I remember while I was in school, maybe you could identify it. Okay, just allow me to say it that way.
Okay.
The tiny, sickly looking ladies back at school. So ungesikia watoto wakisema ujue huyu ako na sickle cell.
Okay.
So it did not resonated well like ile unaelewa vizuri. But we just knew that it is sickle cell and it is deadly. More to that, no.
Yeah.
Came a time when I finished my Form 4 and immediately after my 4th form, I decided to get married. At 18 years,
Yeah.
Then I got pregnant, blah, blah. But during this pregnancy, something was not adding up. My HB, my first pregnancy actually, for the boy is the second born, but I have a first born. Actually, I'm a mom to 3.
Ah, wow.
3 boys. And it is the second born when sasa affected na hiyo sickle cell anemia. So during my first pregnancy,
now after Form 4?
After Form 4, now at around 18, 19, I was pregnant for my first born.
Yeah.
So, like, there are a lot of things which are not even adding up. And at that time, I never even thought about sickle cell. I had low HBs. Damu, kiwango ya damu ilikuwa inaenda chini sana.
Okay.
So, at this point, I think it was my last trimester. I was diagnosed with serious anemia, and my blood stood at 4.2. You can just imagine you're pregnant, you're almost, you're due, and your HB is at 4.2. Then at this point, I was referred, and that is when I got my first transfusion.
Allow me interrupt 2. It was at
4.2.
4.2. Inafaa kukuwa ngapi?
The normal hemoglobin rate inafaa ikuwe from 12. From 12, eh?
Okay. So 4.2 means it's lower.
It's much lower.
Okay.
And you just understand the whole procedure of maybe giving birth.
Yeah, true.
Can lose a lot of blood, blah, blah. It's just a lot. Eh?
Okay.
After around 1 week, I gave birth successfully.
Wow.
But I realized
Yeah.
my immunity was a bit compromised. Actually, I've been battling in this issue of poor immunity. Little did I know that I am a carrier to sickle cell anemia.
Or someone can be a carrier to sickle cell?
For you to have a sickle, ndio upate mtoto mwenye ako sasa confirmed sickle cell anemia, you must have to be a carrier.
Now, how did you know you are a carrier?
This one I know later. Let me just...
Okay.
So, I gave birth and... after some time, my baby, my baby was okay. He was just getting the normal infections kama mtoto mdogo. Now my firstborn.
Okay.
My firstborn is not affected in any way with sickle cell anemia because he's neither carrier, he's a totally normal. He's a normal kid. But I faced the challenges. My body went back to normal. And after 2.5 years, because I really had this notion of, let me do it haraka nimalize.
Oh, yeah. Ukianza ni pa.
So I thought of getting another baby. Well, my firstborn was 2.5. So I got pregnant now for my boy, who is now a sickler. Mwenye sasa ameathirika kabisa.
Now the second born?
Yeah, the second is the second born. He's called Brian, yeah. So... the journey, I went back to the same journey. Now that I knew what I was supposed to do, the measures to take, ndio nisi drop kiwango ya damu. I used to be on the supplements. Nakuwa serious, I take a lot of mboga za kienyeji, nini, and it went well. It was a smooth pregnancy.
Maybe if I may ask, like personally, I don't know, what are some of these supplements that maybe we can take so that we prevent the hemoglobin kukua chini? What are some of these supplements?
I was on iron supplements.
Okay.
And these are things, it doesn't mean that you must take it maybe from the food. So lazima, I mean from the medication itself. Yani unakuwa to something holistic. Like mambo yote, unajua sometimes pia ukikunywa dawa sana, it is not also good for our health. So nilikuwa naweza kula mboga za kienyeji, a lot of fruits, a lot, and through kukula vitu kama hizo, ina maintain, ukikula vizuri, then you do it the right way. Ina boost hiyo kiwango ya damu kabisa. The lowest I dropped was I was at around 9. You know, there was still a drop,
Okay.
Which was not that bad for
but at least there was a difference from your first pregnancy was 4 point something.
It was 4.7.
Then now we are in the second one and it's 9. Okay.
I was staying in another country. Okay. Then I came back to Kenya. I gave birth. It just now you can understand home.
Yeah.
East or West home is always the best. I gave birth. Then after 2 weeks, I went back to where I used to stay. By then, another country. Then I realized within 3 days after traveling, because I can say the weather is just the same. Like if you compare the weather maybe in Kisumu, na ile yenye kwa Uganda around, there is no big difference. So all of a sudden nimepata mtoto. Now I have 2. Then I'm a mom to 2 boys. Aya, sasa naona kama this younger one anaanza kuleta fever. Every time anaanza kugonjeka. Then you know as a parent you will not sit and watch.
Yeah, of course.
Kawaida mimi huyo hospitali. Daktari, my baby is not well. It's 2 weeks. Then what might be the problem because it is too early?
Yeah.
Then he used to be treated malaria and maybe some infections, of which I used to wonder, infection inatoka wapi at this age?
Yeah.
Then it became somehow recurrent. Every time we are on and off tunaenda hospitali. Sasa hiyo ndilikuanga jani like mimi hata singeweza toka niende mahali like jirani hata akiona nimebeba my baby ananiuliza mama Brian unaenda hospitali. You can just imagine.
It now became a norm that now people will know wewe ukitoka tu ni hosi.
You cannot even go and enjoy your life elsewhere. Useme hapa wacha nitoke. Kila mtu anajua, and it's true to their words. We used to visit. We used to have these several visits to hospital.
Okay.
So iliendelea hivyo mpaka tukafikisha around 5 months and some weeks. Now the boy became seriously ill. And that was the time we first got our first admission.
Okay.
And to my surprise, his HB was at 6. Imagine this is someone who is a baby at 6 months already. Kiwango yake ya damu imeshateremka mpaka imefika 6. Then at that point, malaria, unajua kama Kampala, in Uganda, somehow bado ni malaria zone kama tu around Kisumu, Kakamega, and coastal regions. So he was tested malaria and he tested positive. Akatibiwa. After kutibiwa malaria, akatibiwa some infections, tukakaa hospitali for, it was around 1 week. Already hapo, because the blood was at 6, kiwango damu ilikuwa imefika 6, he had to get the first transfusion. Aliongezwa damu for the first time at 6 months. You can imagine a baby getting blood at 6 months. You just understand a lot of issues zenye watu wanakuambia usikubali mtoto kuwekwa damu. It will not react well with the body, nini. And this is something I don't want to assume. Unajua pale, there are churches, kuna wamama, kuna like mtu anakuja kuambiwa mambo mingi sana. For the parents, wenye wako na watoto kama hao, tafadhali ikifika mahali daktari amekwambia, you need to get that transfusion. Please just do. Toa a lot of things, because I believe inafanywa na professionals, watu wenye wameisoma vizuri, because so far Brian is now 13 years na sijaiona any side effect maybe. And he has got numerous.
But now you to yourself, what was going through your mind your time unaambiwa huyu mtoto anafaa kuongezwa damu? What was really going through your mind? Ulikuwa unafikiria? Because I believe there was fear, kulikuwa na uoga kidogo. Yeah, what was going through your mind?
Actually, I was told it's malaria. And it can cause anemia. So I never doubted my
directly.
Job. Yeah, I'm a person who is always like, I like to know a lot. So I normally question a lot. Sana when it comes to maisha ya watoto wangu, I don't take any shortcuts. Nitauliza, now that we are giving this blood, why are we giving it? Na ni nini imeleta? What are the measures? Ni nini tunapaswa kufanya? Ndio tusipitie something close
like
to this.
That.
So the doc was like, Mama Brian, huyu mtoto amepata malaria, and malaria, unajua venye ina affect hizo damu. Malaria, the moment imeingia kwa damu, inavunja tu damu, inavunja hizo.
So this is now a doctor explaining it to you.
At that point. And I just had little knowledge, like, mtu anaweza kuwa anemia, nini malaria, but I never knew. Kama ni sickle cell, mimi nilisoma shule, then I closed it.
Okay.
Just like that. So I was discharged. And to my surprise, I think after a week the boy was again sick. And this time around, it somehow came differently, because now he was having swollen fingers. Vidole zilikuwa zimefura. So because I had firstborn na wote walikuwa wadogo, I thought maybe inaweza kuwa huyu alimlalia ama alimvuruta kwa kitanda. You just understand at that age, we anataka like, this is my younger bro. Saa zingine
they want to explore.
Mara kwanza nilikuwa hata napata nimetoka kidogo, coming back napata namvuruta, mom, the baby is crying. Naletewa, unaona.
He's trying to help out.
So a lot. And at that point nikasema, what I think inaweza kuwa it's either huyu alimlalia ama alimfinya na kitu. Kwa sababu, and he was crying a lot. They were swollen easy, kama hizi 4 zilikuwa zimefura. So nikaona kulia inaongezeka, then he started developing some fever again. So I'm like, now the fingers are swollen, fever. Alafu kwa mkono hivi bado kulikuwa na, ukimshika maybe ungefeel like he's in pain. Then nikasema kawaida yangu, then I say no, let me just take him for the checkup, maybe ameteguka, juu hizi zimefura, alafu hiyo mkono haezi inua nini. Then I went to the hospital, and this time I think I interacted with a different doctor. And to my surprise, alikuja akatibiwa, akadungwa dawa za pain. Then we had this the conversation with the doc. Akaniambia, Mama Brian, there is something I want to tell you. And okay, we just want to take the precautions
Okay.
at least tupime in case mtoto anapitia kitu kama hiyo, we'll see on what to do. Actually alikuwa amepitia angeweza niambia direct.
Yeah.
You know, at that point I was a young mom, mama watoto wawili, hata kuinangalia still naive by then by day. Si kama saa hii at least you can withstand such So nikaenda akapimwa, akaniambia like we need to test for sickle cell anemia. Mostly wanaulizanga na hapa any mother mwenye amekuwa na mtoto kama huyo kana test weight
Yeah.
Kwa familia yenyu kuna mtu mmeona kuna sickle cell anemia?
Now the doctor is asking you. Okay.
Then I was like no doc. Kwetu we are 6 na sisi wote tuko. So we've not lost even one.
Yeah, to sickle cell.
Tuko wote. So even in our family nikiangalia vizuri, I don't remember. Hakuna, by the way, it was not there. Then the doctor was like, but at this point, we just need to conduct these tests for the boy. And you'll come for the results after maybe 2 days. Ukuje tuone like what's happening.
Yeah.
I went back home but I was worried because sasa unajua hapa anakuambia like hizo vidole kufura. We were supposed to go for an x-ray kupigwa picha.
Umetajiwa sickle cell.
Nimetajiwa hiyo. Then I remember back in school nilikuwa naambiwa like huyu because they you know their nature, they are tiny.
Yeah.
So tungeambiwa huyu akona sickle cell anemia. Na alafu unaona most of them, and I just want to be honest, hawakukuwa namaliza form 4. All of a sudden they disappear. Then utakuja kusikia so and so died. Unaona. So you can just now connecting the dots. Then you kunaenda. So
uli flashback kaanza kukumbuka tukiwa form 4 they used to say this.
So I was a bit worried. So after 2 days
you didn't Google?
By that time I think I had a phone, but
it didn't come to your mind that nafani Google?
Not. Actually I used to disturb. I even have a friend, a nurse. Kila wakati nilikuwa naenda kwa what are the signs, and it happened that nurse was also having a sister. They are 6 in their family, but their last born. Kumbuka watano wote wako sawa, but their last born is a sickler.
Okay.
Sasa ndiye alikuwa ananiambia it's something you can manage. Kumbuka hata sijapata results, but I was somehow worried. Hiyo siku I kept time. Daktari aliniambia nikuje saa 2, by 8 I was there.
Wow.
I was there to receive. I just wanted to remove that burden from my back. I was anxious. Then the worst, that is the day I got the worst. Actually, up to date, I don't like that day. It was the day I got the worst message in my life. Zingine zimekujanga tu, but this one
it hit really hard.
Ili hit vibaya sana. Nikaenda daktari nikampata, by the way he was also an early person. Akanikaribisha vizuri. So nikaanza kusema why is it that is so nice anataka like to create that environment so that ni feel at home, but even by doing all this bado sikukuwa nimesettle. Hata singeweza keti kwa kiti hivi. It was hot. Wow. Then he started like, Mama Brian, I'm happy you're back. You are here for the results. A lot of narratives. Then he started asking me the same question
that he asked,
and he was having that brown envelope in front of him
with the results.
With the results. So I was like, umesema kwa familia yenu hujaiona, have you ever maybe see someone mwenye ana suffer from sickle cell anemia? Then I was like, mimi sijawahi ona doc. So nilikuwa nimemwambia that day, sickle cell is just like any other chronic illness and ni kitu yenye we can manage. Kwanza yeye, he did not even mention mambo na the dawa hospitali. Alikuwa ananiambia even in our country here we have Masais, they have good herbs, they can like. Then I was like, now this is a doctor.
Tena ananiambia kuhusu Masai.
Ananiambia tena dawa za Masai.
We are not against Masais. Kindly.
Yeah, we are not against Masai, but so it was a bit ironic. A medical doctor talking about Masais. He handed me the envelope, the brown envelope. It was a brown one, not a white. Kumbuka.
A brown
envelope. Kuniambia, so the results are out and kumbuka shaniuliza zile maswali. Kwenye kuna sickler, akaniambia now the results are out and here is it, but meanwhile your baby is reactive. In English,
when you say reactive, Unamaanisha nini?
Nikisema reactive inamaanisha it is something which is there.
Like
But at that time unajua it was as if sijui maana ya reactive and maybe something is not reactive so I was like, am I even dreaming? So nikauliza doc, reactive as in unamaanisha nini? What do you mean by saying reactive? Akaniambia from the sample we took inaonyesha mtoto wako ako na sickle cell anemia. Then
so that's why he used the term reactive.
It's positive.
Okay, it's positive.
It can be traced.
Good. Yeah.
I was lost. Kama dakika 3 tu. Hata sikujua, like I can't even remember what went through my mind at that time. But I was totally off. Nilitoroka hapo, like I was not there. Actually, immediately I got that message. The only thing I saw was death.
At that time you're still holding your baby?
I was holding my baby. He was 6 months. Amekaa kwa mguu yangu. I was holding him. Nimeambiwa is reactive. Then I was like, reactive ni nini? Akaniambia mtoto amepatikana ako na sickle cell anemia. Then mimi sikufikiria anything at that time. I got lost. But the only thing I remember niliona, I saw death. I just picture my baby in a coffin.
Dead. Okay.
At that point,
sorry.
So you can just imagine the pain of seeing maybe your baby in a... And the feeling was real.
You're imagining these things.
Sasa unajua mtoto amegonjeka and by the time wanagonjeka you bond a lot. You bond a lot because each and every time you're with him, hatuwezi mwacha na mtu. Like hata ukienda, at that point I had a house girl. But hata sikuwa naweza kubali hata house girl. Like hata kumwacha hata dakika 5. Like I just, and that thing bado inanihapenia mpaka saa hii. I can't lie. Nikimwacha kidogo moso kama asikii vizuri, somehow
you're not comfortable.
I don't like calls from home. Mimi natakanga ni keep like niwapigie but sipendi kuona
kupigiwa.
Yeah, so
maybe before we continue, now the doctor has confirmed that this baby is a sickler now. And hapo nyuma ulikuwa umetutajia ukatuambia ulikuwa unaona mkono inafura. So maybe if you can just maybe tell us what are some of these signs now that the doctor has confirmed that our baby is reactive and now ikitu iko kwa mwili.
Okay, there are many signs and you know for kwa magonjwa we have a lot of maybe some signs zinafanana. But it is always good not to assume some things because for sickle cell anemia at that young age wanapata the swellings kwa vidole, wanafura vidole, wanafura miguu. It is called dactylisis kwa ile lugha ya medical
Hebu iseme vizuri.
Inaitwa dactylisis. Zimefura, then every time anemia, the low HBs, damu iko chini, then they face frequent infections now that the immune system, kinga yao ya mwili imedhoofika.
Okay.
Sasa every time you're just on and off, unaona they have jaundice, the eyes is in a yellow. Yellow eyes, iyo kufura miguu na mkono, or any other part. Then they face painful crisis, not for all, but these signs zina differ.
Okay, from child to child.
There are those who maintain low blood levels, kiwango ya damu inakuwa chini sana, but our experience any painful crisis.
Okay. Kufura vidole za mkono na miguu. And then you say jaundice, yellow eyes.
Low blood levels.
Yani
mtoto kila saa ukienda hospitali akipimwa, damu yake ikoangi kawaida like any other normal.
And in the beginning you said the blood level should be at
12. From 12 it's a good one,
So ukiona mtoto wako below 12, please. Visit the hospital.
Again, frequent infections because the immunity is very much compromised.
So there is frequent infections again.
Frequent infections,
Then you talked of something about the chest.
The chest now, it is now a complication,
But maybe. Then these signs differ from different children. So maybe your child is having different signs. Yes.
Sipendi calls kutoka nyumbani. Because truth be said, most of between 0 to 5 years. Si rahisi hapo. Because the immunity iko chini, so every time they get sick, every time na ile month yenye imepita hajagonjeka, they used to celebrate. Ila tunalala usiku like you can leave any time.
Bila stress.
Nikapata result. Akaniambia and remember mpaka saa hiyo mimi sikukuwa hata nimecome to terms na hiyo nini
the condition.
I cried. But nalia. Actually nilikuwa nalia like someone who is anamon mtu mwenye amekufa. Because mi sikuwa naona if I'm holding a human being. Nilikuwa na feel like this baby is just dead. I'm just trying as a mother. So that pain of maybe losing someone close to you,
Yes.
kama mtoto nini, I felt that pain.
So sorry.
I felt it. So nikalia hapo, then the doc was nice and I'm really grateful. I'm really grateful for him. Juu alinipea time. Nikajaribu like just to express my emotions. Ku express venye na feel hivyo nini but still mimi tu yangu tu. Sikukuwa eti hata I left there better. No. Pale nilikuwa I had to cross the road. Mimi nilienda hata sikuangalia hata barabara. Actually sikuangalia. Nilikuwa na cross tu, then hata basi ikakuja sikukuwa nimeona. Then nilisikia tu ikihut. And I was crying holding the baby. So watu wanajaribu kufigure out unajua like what's wrong with her. Naona amebeba mtoto. It was a big hospital, so they are like ama ameleta mtu amelose mtu, unaona. So they are really trying to figure out ni nini mbaya na huyu mama.
And at that time you're still holding your baby.
I was holding my baby tightly
and you're crying.
And I'm crying. I'm going home. Na nikapata my landlady there, but then alikuwa she was very supportive. Jata yeye kuna mali mtoto kugonjeka aliwahi niguzie hiyo mambo. Can you taste for this?
She mentioned
if I can risk and test for sicklecellanemia.
Oh, okay.
So nikampata and I was crying. Akaniuliza, how are you? Then you know the normal greetings. Jevareko nikamjibu hivyo vizuri. Then Kenya aliona I was crying. I was crying. And I informed her of every step, like, you may test, I'm going for the results. So she gave me time, hakutaka kubother. Nikaenda, nikajifunga kwa nyumba yangu. I cried. So even the baby was wondering. Unajua at 6 months ananiangalia like, maybe he was trying to figure out, now huyu mama analia. Nini, ananiangalia. Like, na feel kama pia yeye alikuwa, because of that connection. Alikuwa na feel that pain, Sasa ananiangalia, I don't know what to do. Nikapigia babake, nimetoka hospitali na nimeambiwa sasa mtoto ako na sicklecellanemia. Then the response was not that good.
Would you maybe mind telling us the response?
Actually it was through a phone call. Akaniambia, sasa hizo zimetoka wapi? Mi kwetu sijaiona.
I get it.
And I never expected that maybe from him. Actually I understand him because hata mimi at some point denial. Denial, then lack of enough information.
Yes.
Because for you to get, as they said before, for you to give birth to a sickler, lazima mkue both of you are carriers. You carry the gene, I carry the gene.
Both you are the man and the woman.
Yeah, both of you must carry. Then it's a probability. Ni kama tunasemanga 50-50 in each and every pregnancy. Meaning nikisema 50-50 kwa kila pregnancy, now that I carry the genes, I'm a carrier, na my spouse is a carrier. Kwa wale watoto tunaweza zaa wote wakiwa normal, depending on the year 50-50 probability. Ama tunaweza zaa wote wakiwa sickless. Ama at the same time, tunaweza zaa kuna wenye watakuwa carrier kama sisi. Unaona, depending na venye hizo genes, like for those who understand, kuna venye hizo vitu zinapea. Hizo vitu zinaitwa genes. Zinapea. So you can have a normal kid, you can have sickless, na bado we can have carriers. So even me, I was lucky because my firstborn is normal.
He's very okay.
He's very okay. I did the HB electrophoresis for him.
What's that?
Like it is a confirmatory. Ni ile test ya kuconfirm. Na si eti itatolewa damu, then inapimwa genes kabisa. So ina confirm kabisa that it is the last one, a confirmatory. Hizi zingine utatuma utafanya tu, itatoa any result, but that one now hiyo ndio enda fanya ile test kubwa, unaona. Ile test kubwa ya mwisho yenye msema kweli.
Okay.
In simple terms, msema kweli. Nikawafanyia wote. Actually the first born is normal. And the second born was my brand now, the sickler, is 67%. the sickle cell level, the sickle cell rate
It's at
that
67%.
67%. Now you can just imagine him maybe surviving with 33% normal. Naona na bado kunaweza kuwa na nini, it can rise ama itarudi chini depending yako kwa medication. What are the factors zenye zina nini zenye inaweza kuwa inachangia ziongezeke? I have to express my feelings, ndio my partner ameshanipea that nini, but sikuichukulia vizuri actually because I was badly off. And now I know I understand him better because he was also in denial. Actually naona kama ni mimi fikisha message vizuri. Ati nimeshatoka nichukua result na nimeambiwa ako na sickle cell.
But then now do you blame yourself?
No, I don't blame myself actually. Sijilaumu because now that I understand what I was going through at that time, actually I'm strong. Niko na hiyo nguvu sana kulingana na venye, at that point I was young, naive, trying to understand all this. Hapo sasa we started the journey officially. Now we are starting the journey. So nile nikienda I hate to mention in each and every visit, nikifika hospitali I have to mention, doc nimekuja but this is a non-sickler.
Something has just crossed my mind before maybe we continue. I'm sorry to cut you kindly. When you called your husband, you told him, sasa baba Brian, nimetoka hospitali, nimepewa results, nimeambiwa mtoto ako na sickle cell. And then the first thing you said he mentioned was, hakuna kitu kama hiyo kwetu, hizi ni vitu gani? Yeah, so does it mean that sickle cell maybe it's a curse, a bad omen? What can you say?
No, depending na community venye wana treat the society, you know there is a lot of stigma concerning hiyo ichi. Kwanza wakisikia mambo na sickle cell anemia, hiyo wakati hata yeye for him to deny, maybe alikuwa anataka it was just maybe a denial ama for him to cope with the situation aseme like hajaiona kitu kama hiyo wapi maybe kujiondoa a defense mechanism ajaribu kufanya nini kujiondoa kwa hiyo situation. And it is something we really understand. Kila mtu any sane, any human being lazima ukijipata kwa situation utataka ile njia ya kujiondoa, at least to shift the attention.
You want to check out.
You check it out. I think he was also battling the same emotions kama mimi because huyu kijana ni kijana mwenye amependwa kwa hiyo nyumba.
The second bond now.
Wanapendwa wote to the same. But you know now that bond every time. So hata nakumbuka I used to call him mayai yangu. He was a bit delicate every time in and on and off kwa hospitali nini. So like focus yote ikarudi kwa huyu mtoto. So can just imagine that bond. Akaniambia mtoto wangu akasurvive. So now jioni sasa amefika from work, akaniambia it's okay, tutafanya nini? Now we just have to raise the boy.
Now the dad is saying that. Wow, that was so bold of him. So right now that we have the condition, we know about it. So how are you managing? How is life different?
Managing it is a bit hectic because it requires a lot of your time. It is draining. It is just like any other chronic or terminal illness. Sickle cell is draining because you must be there. Your presence. And what do I mean by the word your presence? At some point you are there. You have to work as a person so that you can provide, because the medication the general management is expensive. Nutrition wise, medically, even psychologically, because these people they need that holistic care. Ile care ya all round ile care ya all round so lazima management ikue juu, diet yao lazima ikue poa, medication lazima ikue, they must go to school because apart from sickle cell they're just doing normal as other kids.
They're just like normal children.
They're just like normal children. They have their dreams, and we have support groups. We have those who are old now. We have, like in our group now, the oldest there is 56.
Like you have a support group for what?
For sickle cell anemia. We introduce new parents. Wale wenye wamekuwa kiendelea to encourage juu. Unajua huko nyumbani, wacha nikuambie Mary. Unaona hizi societies wako na a lot of maybe the myths concerning sickle cell. Kuna wale mtu atakuja kwambia ni uchawi, kuna ule mtu atakwambia ni sijui imerushiwa sijui kutoka wapi. Like they just have a lot concerning the issue. So unajua wakati watu wako kwa hiyo support group they get that sense of belonging at least they feel safe, they are not alone in that journey. So unajua the moment utanini watu, there are a lot of advisors hapa nje. Huyu naye sioni tukitoboa. So unajua utakuja na hiyo mentality like hatutatoboa. So pale wakijoin umeshaambiwa hatutatoboa. And like I've said, in our group we have, ours is 56 years. Wow. Actually, by that time I was introduced to a doctor in Mulago in Uganda. He was 80. And he was heading that department as a non-sickler. 80 years, 80.
So is there a way maybe someone can join this group?
So maybe you must have at least, because we have these routine checkups, the clinics, so maybe from, you know, it is always good to do that routine check because we have to check for maybe the blood levels. It's something routine. Inafanywa na pattern. After 2 months, now that mtu wakati ameingia kwa hospitali, kuna medications. Alafu, na kwa hizi medications, venye tu nilisema, hizi dawa ina react different to individuals. Venye ita react na mimi si venye ita react na wewe. So unaweza pata kuna those who are doing fine, kuna wale wenye watakuwa wameleta shida kama like renal impairment kama unajua dawa at some point mtu akikunywa sana inaanza kuharibu some organs and it's something which I must just talk about it because there are people who are experiencing the same. There are people like, but we have majority dawa sisemi dawa ni mbaya ni poa but just for few individuals yenye ija react vizuri na wao unaona na utajuaje ime react, you must first take it, you know, you go for checkups, wafanye the liver function, the everything, the organs, ndio. That is why we go to clinics at some point. Unaenda unafanya hizo test waone like how is it reacting to your organs. Routine it is somehow. Kuna wale wenye wako wamedhoofika sana, they can go for monthly checkups. Kuna kama sisi sasa we do 3 months and you just remember we do it and whenever you go there it's money. It's
so after every 3 months, like you visit the hospital, you go for clinic kinda.
We go for clinics,
okay.
So that they can perform they must check the kiwango ya damu, the HB levels. Lazima waangalie like actually ukienda hospitali it's always important kufanya full blood count, full hemogram, ile yenye wanaangalia kiwango ya damu. So si venye nilisema kama ile kiwango ya damu ya kawaida inafaa ikuwe 12 wakati tumefanya ile test yenye inastahili they check for the hiyo kiwango ya damu alafu unajua hizi damu ziko tofauti like damu ni moja but iko na chembe tofauti so utapata kama for example kuna range ile si unajua ile damu yenye inasaidia kunini ku fight for infections. Now that these people are prone to infections we know the level, tunajua inafai range from here to here. For example, let's say maybe it's 12 na upate kama white blood cells inafai fight for the immunity. Unakuta ile level yenye inafaa ni 12. Umeenda hospitali wamefanya that full blood count kama iko full utapata iko 53 and it's something which is supposed to be 12. Hiyo inamaanisha nini? It's 53 meaning zime rise, it is supposed to fight for something in the body na ime rise to 53. What does that tell? There is an infection imekuja mingi hivyo to fight the adui kwa damu. Na adui ni ugonjwa. So that is those are the examples. You see like wale wenye wanakuwa affected na malaria unakuta the neutrophils kuna damu hapo hiyo unajua malaria ikihit body hii damu itaumia sana. Hiyo ina affect maybe the red blood cells utakuta zimedhoofika imerudi chini kabisa. Maybe the level is supposed to be 3 utakuta ile iko 1, the level is supposed to be 10 iko 3. Yani zimekulwa. So inapea daktari that insight to say maybe this kid might be suffering from this and just by analyzing that the report, that medical report from that test the doctor will be able to know that huyu ni kama maybe infection ni viral so atajua where to start alafu venye atafanya nini venye ataendelea.
So you were talking about one of the management, it's number 1, you've said we should put God first. And so maybe are you having any support system, anyone coming through for you at this time that now you're living this condition?
You know, okay, actually have a friend. I have a friend who happens to be my spiritual mother. She has really supported me a lot in this issue, spiritually, like holistically. She's been present.
Wow.
And it really facilitated the full accept, because at sometimes you feel bitter. Unaona wakati issues zimekuwa mingi sana. Like for example, it's unfortunate but I just have to mention it. Right now I'm taking care of my boy single-handedly. Because you know it's not an easy task. Na kama uyuko sawa with standing such, inaweza kuwa ni challenge. So at some point you know must lazima uende job. You need that work. Life ya huyu mtoto pia somehow apart from hiyo mambo ya Mungu, yes, the God is there. But wewe pia una that physical presence ina stahili. Because like my ever worst experience iliniacha kwa 4 months in hospital. You understand? 4 months in hospital. And you remember you're supposed to pay rent, you're supposed to provide food they eat. And 4 months in hospital, and he was in a very critical condition. So lazima you think about the rent back at home, the school fees. You understand I have 2 more. I have my mom to 3, as I said before. So at this point
the third born already ashazaliwa.
Yeah, because walifanya actually the third born came a year after. They're like twins. So you know it was somehow sikukuwa hata okay, alikuja wacha tuseme hivyo. Alifika and I had to embrace to take care of him, though nilikuwa na lot of anxiety. Sikukuwa najua juu unajua ni kitu yenye inakuja it's 50-50 venye nilisema. Huwezi jua kama you'll get another kid pia because the dad is the same.
And now that we have now a third child, are you now at a point of now I have accepted I have this, or you're still 50-50?
I'm
you're
not
still
50-50.
in denial?
I fully accepted. And my journey of acceptance ilikuja mahali unajua sasa pale Uganda ilifika time like we had to shift turudi Kenya due to maybe hizo transfer za job na nini. So sikuwa nataka like tufanye that distance relationship. One person in Kenya, another person in Uganda. Then we have kids who are young. One is sickly, unaona. Juu kila unajua at least ile wakati I'm in the hostel, hata kama wengine watabaki kwa nyumba na the house girl,
their dad is there.
The dad is there. Unaelewa. So tukarudi Kenya. Actually hata Kenya the confirmatory test mimi nilifanya Kenya. At some point nilienda nikasema like let me just go back home nione what they are saying about that issue. Nikakaa nyumbani kidogo around 3 months. Just dealing with the same hospitali kila mara kila saa. So unajua like what hurts most hata pale niko nyumbani like where I was married by then kila mtu anashinda they see me as the problem. Mimi mama like hii kitu tujaiona in this family.
Kwa hivyo ni
hii imetoka kwao.
I hear you.
Unaelewa. So wewe unakanga tu ya bitter with life like at some point you rebel. Like unaona kama kuna uhusiano mzuri na because wanakuhurt but they cannot know they are hurting you. And at some point hata sijakwambia Mireille was almost forgetting this. Now there was a point my stepmother-in-law alikuja akaniambia Lilian, nimesikia kuna mtoto hapa anagonjeka. They called him Jatuo, meaning ule mtu anagonjeka kila saa. There is a very nice doctor somewhere in Horoni na anatibu hii kitu mpaka inaisha. As a mother ungefanya nini?
Naendea.
Umesikia inatibika na you see how your baby.
I went for it.
I expected medication because I'm this person nimeamini sana kwa mambo na dawa za hospitali. Compared because you never know whom you are going to maybe to interact with. I went there, then tukaingia kwa room. We were waiting now for the doctor. The doctor came in a very huge kanzu, a red one, and he was having some dreadlocks hizi kubwa, the big ones zinafika huko. Then we started anaomba, yes I believe in prayers. Akaomba tu vizuri. Then sasa anaanza sasa kusema things which did not resonate well with me, and I'll identify I was a bit rebellious because he was busy calling Abraham Moses on just like this a call. So he was like, hello Abraham. Then he was, where am I? I came for help. Now this man is calling Abraham. Akaniambia no, you know, hii kitu imesukumwa na kutoka like ni mapepo. So you need to have candles, different colors, maybe a red one, a yellow one. It is something I believe watu wamepitia.
Yeah, true.
Because sisi unajua
Very true.
Ukisikia kitu kama hiyo, you'll always go for, uambiwe tu yani nakupea help. Kaniambia you need to buy, I don't know, 17 candles so that we can turn that problem tusukumie mtu iache mtoto. Then I was like,
and you're there, you believe in God. Alafu unaambiwa ununue 17 candles.
Then I was like, hii pain yote tena nisukumie mtoto wa mtu, unajua. Alafu they are very...
Oh, you're being told usukumie mtoto wa mtu?
They call it lokodoche. Like now that the baby was suffering, we need to remove that suffering from him to sukumie mtu. And by doing that, I have to buy 17 candles, different colors.
So
then I was like, unajua, I'm a bit learned kidogo, hii information nilikuwa nayo. Then things are not adding up. And this man of God, alini-identify as rebellious. Alikuwa ananichapa makofi. Like, I'm not concentrating.
I am so sorry. I'm sorry to laugh. I love the way you're saying
at least
it.
now, you know, at least now I can share it. I never used to talk like this. I used to be in tears.
Kumaanisha you...
ananigonga hivi. So that I can concentrate. So I can pray. Praying what? And he's busy calling Abraham. Ametwist mapua hivi. Then he was like, hello Abraham, hello Isaac. This lady is suffering. So I was like, Magita.
What is this? Yeah.
Magitango. From that day mpaka sahi sijai talk to the lady, my stepmother-in-law, because nilikata kurudi kwa hizo vitu. After 3 months nikamjoin Nairobi. Though nilikuwa naambia sasa watu wanasema wananiambia so utaangalia Kenya watu wanasema like mimi ananiambia hivyo but hizi face maybe there are people awambie ni hivi na hivi juu now that tulianza kupata that information. Then I shifted to Nairobi and venye tu anagonjeka tu after 1 week nikaenda hospitali. I went to Neema Uhai Raraka. It's a very nice hospital by the way. Neema is a nice hospital.
It's a nice hospital maybe for patients with sickle cell?
Yeah, they have a very good clinic for sicklers. And generally, it's a nice hospital, from my experience, because it's been a home.
Okay.
It's been a home.
I hear you.
So I met this doctor. She's called Dr. Maria. Akakuja, then we started the journey. Pole pole, but awali, nilikuwa najaribu the best hospital, Not to that notion of, let me try what I tibu. Management-wise, they are nice,
Okay.
But it is a bit expensive. That one unajua.
So your pocket should be
it's either you have a medical cover, a good medical cover, not just a medical cover, a good one, for you to maybe to maneuver through. And mtoto akalazwa huko. The first time I remember back, unajua hizo ni miaka za nyuma sana. Because I think the boy was around 3 years. So he was admitted while they were able to manage that pain within 5 days or 4 days to 5 days. And you know, we parted way with how much? It was around 300,000 Kenyan shillings. And remember, that was on discharge. But we had to make a down payment prior, which was 70. Don't forget that ukiingia pia before they conclude the admission, you pay these small amounts kidogo. So you use around 15,000 or what, kwa sababu natuma go for full hemogram, go for this, then go for lab test. Lazima afanyiwe, angalie kiwango ya damu nini, the rate, the infections. Then wanakuambia now the child must be admitted. And for this admission here, you must have to put that down payment of 70,000.
Ndio tuendelee.
At that point I had a cover and haikukuwa inafika their level. So it was rejected. And we had to do it the cash way.
At this point now, who is the support system? Are you alone in
I
this?
was still with his
with
dad.
the dad.
Yeah.
Okay, so he's coming handy in handy, ako tu in it.
Yeah.
Okay.
Tukalipa, mtoto akatibiwa, we parted with, that was in August. Then kufika November, tukapata the same hard crisis. Tukajaribu, I tried one of the hostels around, I'll not mention the name.
That's okay.
And the experience was not that good because, you know, I understand people come from different places.
Yeah.
Na pia wamekuwa akisikia tu how I used to hear it.
Okay.
So the nurses there walikuwa naitana. Hey, buku jeni muone this patient, so and so. Every night, I just don't like it. He was facing something called priapism. It's a painful erection. anapata hiyo like wakati for boys it's normal very early in the morning or something they tend to erect
It's
so
normal.
for them, for boys it's normal, Mary. It's a normal thing, I'm a mom to boys,
Okay.
So just know that I understand it better. So for them, anapata that pain is a bit intense, iko ngumu.
Okay.
So inakuwa tu inakaa hivyo and it's very painful. So I feel my right was violated, though I just had to let it go. Because unajua hii shida yetu pia, okay, you have to protect your patient na nini, but at the same time you have to consider ujui itafika wapi, ujui hata utadropiwa wapi the patient. Bora umeona like you can deal with it, hakikisha ijaham their mental health. Pia niliassume maybe because the baby was still young by then and then I was still also a young mother. So wanaitana nurses, these are people who are qualified professionals, wanaitana eti mulikuwa mnasikia tu kuja muone. So they had to surround my bed and I felt bad. I told them I'm not comfortable. Nikamwambia hapa mimi sioni nikika because it's cold then. Nurses I just don't like their behaviors. Wanakuja wana surround the bed, wanataka kuangalia. I think they were in the medical schools. I was a bit pissed na nikamwambia just don't like the experience. Then that night we had to call for the invoice. Tujue tumesofa, tumespend pesa ngapi. Actually it was our second night in that facility. We had to take a transfer. It was done immediately because I was a bit furious. Sikupenda actually that experience. And even for the nurses handling such, please just handle this thing with a lot of care. Si kila mtu anaelewa. Unaona, si kila mtu anaelewa. Venye tu, but I understand mtu from a medical school, unakuta most of the time mtu anaenda kwa hizo attachments zao kwa level 5 hostel. Sa utakosa kuona experience kama hiyo.
We are so sorry about that.
Nikatoka, tuka in the same night we went to Gertrude again. Because the other time ilimanajiwa vizuri, So we went back there. The same procedure. The hijab. At that point, hiyo ikukaa sana. We took a spend maybe almost the same amount. Tukapata 294 on discharge. Sasa tukachukua the POPC clinics, so clinics zao sasa. Ulikuwa tunaenda huko na remember each and every visit you have to pay 5,000. Now 5,000 remember is not sick, the baby is not sick. Just you pay your hematologist. Then you pay for that full hemogram, the test I was talking about. Hiyo ni kila mtu mwenye wako na sickle they are a bit familiar with it. Hiyo test inaangalia kiwango ya damu, kama kuna infection. So far hata amekuwa introduced kwa dawa imekuwa aje. So nikaona then we realized hii kitu ina to drain financially. And at the same time maisha ya mtoto iko so we just had to keep tukutaka tufike a point yenye hata tunakosa maybe venye mtoto ata survive kukula nini. So nikarudi tena Neema Uhai Raraka. Then the same doc, actually she's the one who introduced brand true medication into hydroxyurea. It's good for the management kwa sababu now that inafanya kazi in a way that instead of the body manufacturing the sickle cells inakuwa whole. Awali alikuwa amewekwa tu kwa iron just to za supplement, ina supplement your blood peke yake. Then tunaambiwa food. Me I used to, daktari akiniambia hii I just go for it. Daktari akiniambia hii
unaendea
I go for it.
Right now you've just mentioned that hapo awali you could never talk about this thing, but now you're talking about it freely. It means you've healed. So how did you maybe come to healing and acceptance? What really happened? How was it?
Okay, what happened after meeting this doctor from Italy? I think she's still working at Neema Uhai Raraka. So I learned a lot. You try to question like this, like ni ule mtu anataka kukueleza kitu uelewe. Sasa hapo pole we are growing. Then she developed a very strong bond
with you.
Actually I think my son was the first project. Hata she was meeting a sickler for the first time.
Wow.
Because huko kwao si mingi. She's a pediatrician. But she delivered. Actually up to now she's still delivering.
Wow.
She's a nice one. Me at some point unatakanga tu mtu kukuambia it will be fine. It will be okay.
True.
She did it.
She was there for you. So she's one of the support systems that was there.
She's one of the support systems. Even now, okay, I got drained financially and I no longer go there because mapato yangu na pale somehow yambatana. But even if I call her at around midnight, believe me, she will pick.
Wow.
atachukua na niambie tu just to calm me down, aniambie my brain, how is the boy, nini, then kama anaona tu like we need to manage this and this, but make sure ikifika asubuhi you go for the test.
Wow.
That alone, it's
Shout
impactful.
out to Dr. Maria in Maruaka Ruai.
Neema Uhai Ruaraka.
Okay. Shout out to you. Thank you so much for the good work you're doing.
Hey, she's really doing a very nice job.
We hope she sees this.
I just hope.
Okay.
Anaweza kuona hii. Say my boy is 13. He turned 13 on 31st of January.
And
13.
maybe have you ever broken the news to him? Does he know his condition? And how was it? Maybe if yes, you've broken maybe the news to him. How did you do it? Because there's a mom outside there who's having a baby with the same condition, and this mom is confused. How do I break this news to this baby? Nitamwambia aje? He's sick. With which language? Because there's supposed to be a language capacity that they can handle. You know, yeah. So does he know, first of all, about his condition?
Yeah, my boy is totally aware of the status
Wow.
of his situation, because Dr. Maria started that partial disclosure at around 6-7 years.
Oh, so she did it for him?
Anaanza kumwelezea pole pole. Wow. She's a nice one. It's Brian, do you know why you are taking this medicine? At first anaambiwa kunywa dawa so that you don't feel pain.
Okay.
Na ataifanya kwa any language yenye mtoto ataelewa.
Yeah, because that capacity, that language, for them to hold, it's very important.
Atafanya sometimes anakaa akienda anaweza pea maybe through drawings, unaona.
Yeah.
Like unaona like tukienda ana take time, anataka like to break the bond. Anataka tu like anakuwa close, anaambia like why we are doing this so that you don't feel pain. Nini alafu ana introduce kama nimesema that drawing therapy.
Yeah.
Unakuta this is baby moon is happy because baby moon is not in pain. You understand, eh?
Yeah.
So why is that the baby moon is happy? Because baby moon took a lot of water.
Wow.
That is management.
So
you can imagine,
she's trying to communicate to him, you're supposed to take a lot of water.
You are supposed to take a lot of water so that you don't undergo this pain, eh?
Wow, I am learning.
So hivyo tu pole pole tukapata disclosure now, tukaanza kupata the posters na nini hizo concerning kuhusu mambo na sickle cell. Then wanaambiwa like don't be bitter because even mom was not aware. You know, mom loves you so much.
Yeah.
Ikafika even daddy loves you so much. So it was not their intention, eh?
Yeah,
to give birth to you na hii condition. And again, it's a bit disclosure pia ukifanya lazima you check the background.
Yeah, true.
Unakuta kuna wale wenye all of them are sicklers in that same house. So wakikunywa dawa naona mwenzake anakunywa. Unaona hiyo ana accept, nataka the butters from my case.
Ni mimi peke yangu.
Hata alikuwa ananiuliza, "Mom, kwani ni mimi nitakuanga nakunywa dawa?"
Na wenzangu hawakunywi.
Mbona kina Lewis hawakunywi dawa? You understand, eh? Then I just sit down now that Maria alikuwa ashaniambia what to do. Namwambia, "Baba, you know why you are taking medication?" I try to explain to him what happened. Like atukujua, you must have to kusema pole kwanza.
So you like he would ask, "Mom, what's wrong with me?"
Now that every day, alafu dawa ni mingi. 4 tofauti. That one is not sick. But what if he's sick? Bado tuta-introduce injections, to do a lot of orals, maybe the painkillers. Kwa sababu kwa hizi 4 we have hydroxyurea, we have zinc, we have pain V, we have the iron now. So unaona kama hizo, yeye anakunywa daily. Hata saa kutoka hiyo siku up to date my baby kila siku anakunywa. Tu siku yenye tuseme nimelemewa kabisa, it cannot afford the medication. Because they are expensive. If you take them in bulk, it's a bit better. Alikuwa naulizia kwa nini ni mimi tu, nikwambia ile wakati ulikuwa unazaliwa this and this happened and unfortunately but it is not a death sentence. That is why we are even in that the support group. Unajua through Maria we sat down tukasema let us start a support group. Actually I'm one of the founders kwa hiyo support group ya Neema, because sasa tulikuwa tuna encourage new parents
to join.
Sasa it was with Maria, then there is another parent also sasa wakakuja because Neema sasa Maria alikuwa anaona like this issue is a bit crucial because wagonjwa wengi wanaletwa and they are sicklers.
So kumaanisha there are a lot of people outside here going through
such. A lot of people. A lot. ni wengi. Na si hata kwa hiyo support group even had a Kikuyu lady with a baby who is a sickler. So alikuwa anauliza aje sasa na hiyo ni ugonjwa wa Jaluo. Na hakuna mali because unajua people think maybe sickle cell in affect maybe Luyas and you know nowadays even have Kikuyu start sicklers. Because ile wakati watu walikuwa nafanya ile the businesses nini our women wana interact na maybe Kikuyu ladies, unaona, then things happen.
So haijui mtu it can affect anyone.
It can affect, na akienda huko ataacha the carrier gene. Unaona akiacha hiyo gene ya carrier, nilikwambia how they pair. Sasa pia ikue pia ameenda imezunguka imekutana na pia Mkikuyu mwenye aliachiwa that carrier gene, it will manifest.
I hear you.
Lillian, is there a known case study yenye a sickler was completely healed? And if there's a way someone can be healed, is it affordable? And how is it done, Pia? If you've known by chance, maybe.
Okay. So far, there is a case study, though I've not interacted with them one-on-one like this maybe, but through our groups, unapata there are people who tried, wakaenda like they went to India and wakafanya, there is a treatment, that one is inawapea complete healing. Like itamsumbua tena. Itamsumbua tena. It's a bone marrow transplant and it's a bit expensive because I understand that not less than 5 million you can imagine. And not less than 5 million and unaenda pale kwanza mtoto lazima kuwekwa some drugs ama the patient hata tu mtu anaweza amua now I've made enough money, I want to go there. So you go there, they put in some medications which are also not good to some, like when you tulisema body na react differently.
Differently,
because even in our group we have people they tried,
but it's not working.
It's not working. It even led to death.
So
wanaenda huko, the side effects of they don't know their chemo drugs or whatever, they cannot withstand the side effects. So you just go there with your child walking ama your patient walking, but they come back in a coffin.
So ni wewe na God.
It is just, and we just have to say the truth. I'm not trying to discourage any parent. Like if you feel you are ready, it's okay. Just do enough research. If you can go there, just go there. Hata mimi mwenyewe ningependa kuenda just because I'm struggling financially. But suppose ningeambiwa pale they are doing that bone marrow transplant, I cannot stay to try it out. I cannot because I don't know how it will react. But make sure you go there with an open mind.
And you want your baby to be okay.
I just want to see my baby free from pain. Atoke kwa hizo like hizo nini, hizo mashida mingi every time you're in the hostel. Imefika hata my Brian, hata hospitali tunaendanga. Tukifika karibu na sisi wote unasikia Brian, how are you?
They know
like,
him.
They know him. He's a celebrity.
Maybe if have you been answered? Now he knows what condition he is going through, and now how is he with it? Is he now positive and may accept? And about now his brothers, his siblings, wanamwona kama mtoto tofauti, wanaona huyu ni tofauti na wetu. How is the journey with him and his siblings?
Okay, from what I am seeing, I think my boy has really accepted that condition. Isipokuwa wakati wa pain, you just know that pain it's a lot. Like wakati wa pain unaonanga like you can tell when like you can learn what is in his mind. Kenye inaendelea kwa akili yake. Anaona like ananiambia mama hii kitu inanitesa, nimechoka nayo.
So he feels like giving
And again when nilikwambia we are in a support group and like last year in their class they were 3 who are sicklers. So unfortunately one akaleta some complications. Alikuwa na gallstones. So
what is that?
Ni ile unaona due to those drugs na nini kwa hiyo gallbladder kuna nini hizo vitu the uchafu inaenda inaanza inaturn vitu sasa inakuwa kama clots. Sasa inaitwa gallstones. Akadevelop hiyo, so unajua inakuja with a lot of pain pia kila saa mtoto ako na pain na nini, so lazima ingeenda kutolewa. So after kutolewa haikutolewa vizuri. so it was somehow leaking. Unakumbuka hiyo what is in there ni kitu kali sana. So mwa chinja kuku kaona hiyo ni yenye inatolewa the pancreas so you can imagine kuna organs like heart, liver, nini alafu hiyo kitu ina leak ndani. Sasa hiyo kitu inaenda ikaribu organs ya huyu mtoto, and unfortunately sisi tumekuwa tukiassure Brian this thing is we can manage it and see it venye watu wanaambia, because even in school watoto wanaambia wewe utafika 16 years wewe utakufa. So it is upon you as a parent to assure them. You give that assurance waambie si ukumbuki so and so. Sitaki ku mention names, I don't know whether they are comfortable with it.
Yes.
So unakumbuka nani kwa group, how old is he? Si ako na watoto watatu. We even in that group even have people who are married. So hapa this is a friend and they are very close. Saa zingine wewe kigeuka kama saa hii unapata wote wako kwa class. They have experienced that painful crisis. Unaona? So tunawambia unakumbuka so and so is married, is having his family na anafanya kazi normally. So at this point kumbuka nimekuwa nikimwashua it is manageable. Na friend sasa ameleta complications and to an extent tulimlose, we lost him last year August.
So sorry.
We lost him and it really hit hard on him. Akaniuliza maswali akaniambia mama sasa uko sure ni sickle cell imeua my friend Then I was like mama is not sickle cell but it is just a complication alipata after the surgery ndio imemuua. Sickle cell haiui. Complication sasa unaona kama yeye just keep taking a lot of water so that hizo ni
reassuring.
Just keep taking a lot of water so that you don't develop a lot of complications. For him it was unfortunate. Alileta shida kama hiyo, then after surgery even that boy died. Akileta alikuwa amefanyiwa 4 major surgeries, around 5 major surgeries alikuwa amefanyiwa but ile ya kwanza juu daktari alisahau kufunga. For doctors who are handling our kids please just be gentle on us just be gentle, because any slight mistake with sicklers it can cause a lot just slight mistake, and this is just a simple request to the physicians, the medical doctors when you want to handle watoto kindly, if you have a sickler and not even a sickler, any child, any child alive, it is alive any patient tafadhali let us just try to handle with care because you never know any slight mistake. For this case unaona kama hiyo ni nayo kufungwa vizuri so it's leaking. Kitu yenye hata wewe mwenyewe ukipika nayo kuku maybe you end up throwing sana. True. Sasa ile inaenda ina destroy the liver, ina destroy like a lot of internal organ. Ikafika mahali like angeweza kuvumilia. We lost him.
But now Brian is okay.
I just had to sit him down I just had to sit him down nimuexplainie like it is not sicklecellanemia but it was a complication yenye ililetwa na hii. At some point we are our own doctors. You just need to explain things, you understand, you try to understand, but make sure before you explain something make sure you have the full information. Don't give out any misleading information
and don't lie to the children again.
No don't lie to them because ile siku ata find out the truth. Kama shule alikuwa anatukanwa unajua they are saying eti mgundogo ndogo, so at some point aligoma hata hataki kwenda shule na short.
So
I had a house girl tulikaa for 2 weeks alikuwa anamwambia eti kiuno yake inakaa kama ya nyoka.
Now his other learners
now this I had a house girl so nakuja we are very free like we are very close kuja ananiambia mom so and so amesema ananiambia kiuno yangu inakaa kama ya nyoka. Then nikaona she was a bit toxic, mimi nilimtoa. Ile kitu pia inasaidia, the dad is not big. I'm big, yes, but the dad is also so unaona I just have to relate. Wakati wanakuita tiny, wakati wanakuambia mguu yako ni ndogo ndogo na nini, wewe babako anatoshana aje?
I hear you.
Waambie baba yao ni maana ono, ndio maana hao ni maana ono. Your dad is a slender one and his body is fit, unaona, you just have to play around with them.
Their mind only at least.
Na imagine nikaingia vizuri so up to this point mtu aketukana Brian sai eti yote na nasema my dad, this is my dad's body. What am I supposed to do with it? Unaelewa? Na ikaingia vizuri. We only think of maybe sicklecellanemia akiwa mgonjwa maybe to manage na sai Brian knows. We have even like our doctor alituintroduce kwa kwa maybe a pattern of, maybe if he's in pain, he can even rate. He can even use a rating scale to rate his pain.
Okay.
Like the other day he was having some pain kwa spine. Alafu nikamuliza, how can you rate the pain, baba, so that what are you supposed to do? Anaambia, mom, out of 10, I think it's 2.
Oh.
Then I was like, and for
and
sure.
he's 13.
For sure
That
it was
is so
2.
good.
Because unaona ikifika 5, like we know when it is a lot, I know when to do this, when to do this, when to do this.
Giving information.
Then anajua mpaka the dosage, ananiuliza like for pain. For pain management unajua utangoja.
Yeah.
Kwa sababu kuna ile hospitali atapeleka for emergency. Upate pale line. Saa zingine you don't even have the finances. Bado unakaa kutafuta. You have to call people. And hiyo kitu by the way, that thing really changed a lot.
So right now he knows about his condition. Hata ako able kuambia mtoto mwingine, like mtoto mwingine mwenye maybe is in that condition. Because you people go to the clinics, you meet other children. He is able to maybe empathize with them. And just tell them, hata mimi niko hivi, encourage them kinda.
And imagine you can easily even identify a sickler. Hata tukiwa kwa barabara.
Yeah.
Anaambia, mom, huyu ni sickler. Kwa sababu you can tell.
Wow.
But for him, I really thank God. Brian kama si mgonjwa, maybe kama macho zimeturn tu. But he's the most active child in my house. Ako active. Ako very active and he's very sharp. When it comes to reasoning, na nini. Yani ni ule mtoto mwenye naweza, I trust him a lot with my money.
Wow.
If I have this amount of money, now we have this amount, we are supposed to do this, this and that. Na imagine atafanya hivyo. Hata sahau, hata tafute mali tumeweka.
Okay.
Anajua, mom, tumeshafanya hii, tumefanya. He is a very responsible boy. And I really thank God for
Something
that.
has just crossed my mind. Is there maybe a way we can, because ulikuwa nasema you people are carriers, you went and got tested and you came to find out that you're carriers. So is there a way that maybe, for example, I'm not married, so is there a way I can know if maybe I am a carrier and maybe my partner is a carrier, so that tusieke watoto kwa mashida mingi? Is there a way?
Yeah.
Oh,
There is a way, because maybe if you're not married,
yeah.
before you get married, just make sure you know your status. How do you call it? I mean,
My partner's status.
your partner's status and yours.
Oh, okay.
So that your genotype, so that you are in a position. Na sai hata ukimpenda aje. And you find out, suppose ingekuwa ni mimi by then. People view it differently.
Yeah.
But that is according to my view and I stand to be corrected.
Yeah.
But it is my own view.
Yes.
Ningejua, I'm interacting with my partner.
Yeah.
It was out of love automatically.
Yes.
But suppose ningejua, my partner is a carrier and I'm a carrier. Cancel.
Because we always focus on maybe HIV, VDRL, the syphilis stuff. Kwa hivyo sasa, kwa hizo vipimo tunafaa tuongeze ingine ya sickle cell.
It actually should be the first one.
So a partner can break up just because there's a possibility of having a child who is a sickle.
Sickle.
It will depend with the partners, but personally.
Yeah.
And that is why we are doing a lot of advocacy.
Yeah.
On that issue. You're supposed to know your genotype. Like a case study here. After testing my boys, then I have this brother of mine. Then he had a girlfriend. And today we have at least a support group, and they'll be providing that for free.
Wow.
You understand? Tutakuwa na that one for free. It will be there. So please avail yourself with your girlfriend. Tujue.
Yeah.
To my surprise, my brother is also a carrier.
What?
Actually, nimeambia mandugu zangu, they have their wives though, hawana
Waende
kesi kama
wapima.
yangu. But this last one hata hajapata mtoto, but he's a carrier. Okay. So unajua he's aware. Akitaka kuoa, it is his responsibility to know that he's a carrier.
So where can we get maybe these tests and maybe how much they cost estimately?
Kwanza unaona for Neema Hairaraka?
Yeah.
I think it goes half price. I'm not sure, but it used to be 2,500. And kwa hizo hospitali zingine, it was around 5,000.
People behind camera wenye wanatufanyia media walikuwa wanasema, wanauliza, unajua wanasemaga ukipima kitu, unaenda sasa kupata uko nayo. Wanasema if I don't have cancer, the day I'll go and test for cancer, I will not have cancer in Jesus' name. The day I'll go and test for cancer, then I will start having cancer. So how is it? What can you say about that?
Kwanza Mary, Kenya naweza sema kuhusu hiyo issue.
Yeah.
This issue si issue kidogo.
Yeah.
And it requires two mature adults to sit down, because this is where we've seen marriages zinakuwa broken.
Yeah.
Kwani wakati wangapi we are in a support group? Kuna mama kona sickles watatu taking care of them single handedly. Why? Kwa sababu bwanake alitoroka because of the status. Anasema analea wale watoto wenye watakufa wote.
Yeah.
I even have people in that the same group. Mtoto anasoma, anafika high school, mama ya bwana anaambia kijana wake eti Nyathina each handle like you,
mtoto wangu
unasumbuka na huyu, at the end of it all atakufa.
Yeah.
We even have medical doctors who are sickless sahi.
Yeah.
Hata last time graduation ilikuwa Kasarani last year for the KMTC.
Yeah.
We had a lot of sickless when you graduate. Ni ile tu ikikuja you have to deal with it. That pain ikikuja deal with it. Kwani how many people are we losing daily?
Yeah.
I was admitted in Kenyatta for 2 months. All the sickless survived. Na tukarudi nyumbani with our babies. Unakuta kids with renal issues. Like so far, if I can sit down and count, I can attest, niliona kama 18 deaths, not sickle cell related.
Yeah.
Unakuta kuna tu mtu aliumwa na kichwa analetwa, kuna tu meningitis. There are a lot.
Wow.
So this issue requires 2 mature adults. Na mukae chini around table. You talk about it. Suppose mumeamua muenda kupimwa.
Yeah.
It's good because it is also good to test your kids ndio. Pia wasianguke blindly. Though tulisema it's 50-50. Kuna ule mtu ako na watoto 5 but the 6th one ndio sickle.
Oh, okay.
Like for my case, I have 3 boys. The first one is okay, second born is affected. Then the third one is very much okay.
Oh, wow. Okay.
So unaona hii kitu ni 50-50 and it requires a lot of understanding. Wow. Because hapa ndio mali wa bwana wanatoroka. Ukuje jioni upate amebeba kila kitu ameenda. Na amekuachia hapo message, mimi sitalea wafu. Sitalea wakufi. That is
the language they use.
Yeah.
Wow. There's a mom outside there going through search. Or kuna mtu amesikia hii story na anaenda kupimwa. Alafu huenda chances are maybe atapata ako hivyo. So what can you tell this person? Partners who want to get married and washajua their status could be positive, ulisema reactive. Yeah. And maybe they can reach out to you. Are you comfortable sharing your number with them just for maybe giving them piece of advice where they can get treatment, where they can go for their clinics? Yes, please.
Okay, we are not going to talk about the moms because I understand we have supportive dads.
Yeah.
And we even have single dads
yeah.
who are their wives went because of the
Yes,
same
true,
conditions.
true.
Mimi watoto nimekuacha na watoto wa kwenyu, so
Yeah.
to maybe to those people, to the parents who are having such or hata sahi I believe kuna wale wenye wamepimwa and they are yet to receive their results.
Yes.
Please, it is a situation we cannot reverse because if it's there, it's there. What I can say, just take it positively but it requires a lot of support and make sure we don't hide away from it because there are people who even hide those kids wana believe ni uchawi na nini. So that is not good.
Yeah.
What we are supposed to do, kindly reach out for support if in case you need any. Listen to your doctors and understand even these doctors you might get the contradicting information about the issue.
Yeah.
Kwa sababu depending with mali mtu alisoma, kuna daktari atakwambia hivi, kuna daktari atakwambia hivi. All in all, because now we have that problem tuko nayo and we understand it better, it is good to join a support group or you can just reach out for any help if you feel umefika mwisho. Like I believe we have a lot of information concerning such because we've been into that issue. Hata sisi even at 13 years, my boy is 13, I still do a lot of research. I contact those people, the older ones. Ulifika aje hii 56, like what is it that I'm not doing right, ama nini nafaa kufanya, and we still get. Unajua every day is a learning day. So reaching out na utafuta where maybe support group where mali kuna watu kama hao, at least you'll be in a position to learn a lot. Then above all, tuamini mambo ya Mungu for those who believe in God, because it does a lot of work for our health. So don't hesitate to reach out and maybe if you feel you need any help, any information or any like support, the psychological support, actually even a debrief, you can reach out through my number and
hapo chini. Are you comfortable?
Yeah, it's okay. Mtaiweka, si ndio?
Yeah, we will share it.
Oh, it's okay.
Yeah.
so that tunaweza ongea 1 2 3 upate, because hata sisi tulizunguka tu hadi tukapata the right information.
Yeah.
And we are surviving well. Yeah.
Wow, thank you so much our viewers. It was nice having you on board. Popcorns yako imeisha ama bado iko? Sawa. So sisi tumekunywa maji tukaongezewa. But we thank God for this information. Personally, I have learned a lot. I don't know what about you, but I believe you've learned the same. Because personally, that was a game changer. I have learned a lot. Umekula popcorn yako ikaisha, sisi pia tumekunywa maji yetu ikaisha tukaongeza ingine. Lilian, thank you so much for sharing the information you've given us. It was tangible. Thank you so much. And so to our viewers, we just want you to know that we are back fully, and it's bigger and better. Thank you so much for having us. Go subscribe to our YouTube channel, like, comment, share. And if you know of anyone whose story will be life-changing, please do not hesitate to reach out to us. And again, if you're outside there and you feel your story will teach us, your story will warn us, your story will exhort, please do not also hesitate to reach out to us. We will share our numbers where you can reach out to, and it will be a great blessing. Lilian, thank you so much. Umechoka?
No.
Thank you so much for coming on board. It was a short notice, but ulikuja. Thank you so much for the information you've just shared with us. It was a great honor. Asante sana.
Asante sana, Mary.
Haya.